Hi friends, it's Auntie Cuckoo here. Today I am sharing all about IV steroids and having an infusion of them in your home. So I just am going through a relapse. I do have multiple sclerosis and I am very thankful this is my first major relapse in 10 years. So I wanted to share a little bit with those of you who may be wondering about IV steroids. You may be looking into it for your own treatment, and I'm currently going through treatment. I happen to be a nurse also, so this time I'm just going to share with you guys what to expect symptom-wise when you take IV steroids. Now, I avoid them because of the side effects. I don't like how it makes me feel. I'm also at the very end, like I said, I'm going to show you a few of my experiences with having an IV line at home, how I take care of it. So, IV steroids are no joke. They are high doses of a very effective but strong, intrusive medicine. It's a lifesaver. It's something that many people have to live on daily. And because they are so strong, they have quite a few side effects. Now, let me tell you about right away when you start getting your infusion. I'll show you guys what the IV setup and the medication looks like here in a minute. But the first few symptoms that I always have that are side effects of the steroid are really bad taste in my mouth, almost instantly. It's very metallic. Some people have explained it as, I feel like it's almost like someone melted a penny and then rubbed the inside of my mouth. So that I sense right away. Also, I get very flushed, which I might be kind of flushed now as well. It sticks with me 10 to 12 hours, then give it 10 to 12 hours and I take the next dose and I'm flushed again. So what it makes you feel like is if you've ever had an anxiety or a panic attack, it's a similar feeling. Your heart gets very rushed, beats very fast, and you get short of breath because your heart is beating fast. So it's that sort of concentrating on breathing because your heart is racing. It's the feeling of if you've ever been startled or scared or very angry, suddenly you get that warmth well up within you. That's what you feel like. You feel very warm inside. My heart gets very racing and I have to take deep breaths. And then the feeling of the taste in your mouth. I also tend to end up with a little bit of a shake or tremor from the steroid. I'm pretty stable right now. Earlier I was a little bit fidgety. That's just me. It may not be everyone. So some very common after effects of steroids that I think anyone who is about to take them should know of. Now, you would think with it affecting your taste that then great, if you're someone like me who's worried about their weight, just lost 8 pounds, I want to keep it off, you would think, great, I'm not going to eat as much because nothing's going to taste good. Your taste is totally thrown off. But steroids increase your appetite drastically. Maybe not immediately the same day, but definitely down the road you will sense a increased appetite, and with that, weight gain. So you have to be very cautious, and even if you're super cautious and you don't end up gaining any weight, which would be amazing, you do end up looking pudgy because the next side effect is moon face, which is a rounding of the face. I'm on day 2 of IV and I can already tell that I'm rounder right here than I normally am. I'm always chubby. I know my chub, but right here I'm getting rounder. So in the weeks to come, if you see videos and my face is slightly different shape, you'll know it's just my treatment. So in the past, I also experienced it. It's a little unsettling. You don't look like yourself, so it's a little strange. Now, if you're not on long-term steroids, continuing for months and months and years, it's something that also fades once they've gotten out of your system. So for a few weeks, I don't look like myself. Another thing that makes you just feel beautiful is that it affects hair growth, and not in places that you may want it to, like, great, I don't have to shave my legs. Nope. It's always right in your scalp line, right in your hairline. I remember it from last time. I had quite a bit of hair loss. The good news is that it thinned and then it came in rapidly afterwards. For me, I'm not sure what it does for other people, but it definitely is not fun to lose hair in your hairline, especially being a female. But when it came back, I felt like it almost came back with a vengeance. So I may go for a shorter cut in a little while to let it sort of grow in. Now, if you're already feeling gorgeous because you've had some weight gain and you're gonna lose your hair, you should also know that you'll probably end up with some acne. At least I did. So I get regular breakouts just like anyone, but this one's kind of different. I got a lot of small pimples, pretty much from like my nose, my chin area. I had a lot on my chest. I think I had some on my back. I even had some on my arms. Acne is a common side effect to the steroids. And now that you're ready to enter a beauty pageant because you're gonna have a change in your face and some hair loss and some acne, you should know that you may also experience hair growth on your face. So if you're a man, great, grow a beard. If you're a woman, not great. I do remember this from last time. It was probably one of the most upsetting things. The moon face was strange because I didn't look like myself in the mirror, but I knew what it was factually. The acne was something I knew would heal and go away. The facial hair was frustrating. Now, I'm a woman of an advanced age. I'm no spring chicken. I have a little bit of facial hair. I'm not afraid to admit it, but this was something I had to maintain daily. And it did also fade with time, so I'm hoping that that happens again. But that was probably the most frustrating, I think, to me, was the facial hair, because it was a lot of upkeep. So another thing, pretty much lastly, before I share with you my daily experiences with the IV infusion at home, is the change in your attitude. So I haven't experienced it yet, but there is something called roid rage. You can become very short-tempered when this medication is in your system. It's a side effect. I know that a lot of people have suffered from it. I think it's really important to have the conversation with family members or anyone who is going to be around you about it and just say, hey, if I get really angry or irritated, can you just calmly remind me it's the medication? I think it's good for them to know. It's good for you to know. I did experience it last time. I wasn't mad or yelling, but I remember feeling very tense inside. You know, the kids make noise and they're just making normal kid noise, and that would make me very nervous. And the other thing was, at night, I would think, okay, house is quiet, I should feel great. I told my husband, I feel so strange. I feel like I just want to go out into the street and run up and down the street yelling. That was definitely a mood effect. Now, also something that reminded me of is insomnia. Now, I have insomnia on the daily, but with steroids, it's totally different. You would think that being on steroids, you could go out and lift a car over your head, you could clean your house and feel fabulous. All these side effects, when I'm on them, make me feel less than fabulous. And it doesn't help that they also prevent you from your normal amount of sleep. You're just kind of amped up a little bit, too much to rest. So you may want to talk to your doctor about that as well. So now let's get into some of my daily experiences with the medication. I'll show you what it's going to look like when it arrives to your home, what to expect, and how to take care of your IV access. So I wanted to show you guys when your medication arrives what to expect. You're going to have a styrofoam box, something like this. It'll have a lid on it that will most likely have your name on it. And then inside, you're going to have quite a few things. I'll show you what those are. But this is very important. Anything that says refrigerate upon arrival, get into the fridge right away because most likely it's your medication. Now they do put an ice pack in there, but as you can tell, it melts pretty quickly. So that is important. A few other things in here, mostly for the nurse, a sharps container. If they have to start an IV on you, you've got some flushes for your line, some gloves and tape. You've got heparin flushes in case you were to have a port. They give you a handy dandy little pack of medication in case you were to have a reaction. Some dressings for your IV. Some alcohol swabs. These are handy dandy for cleaning your port before and after your medication. And then some items in case you need to have a second IV started. So everything the nurse needs is in here. You can then put the lid back on, set it aside until they get there. Let me get this off the table and I'll show you what your medication will look like. Hi guys, it's day 3 of my IV Solu-Medrol infusion. Final dose. I don't know if you guys can notice how flushed it has made my skin nice and red. And also, I don't know if you've seen the difference in my face. Now, I woke up not that long ago. There's a birthday happening in our house, so I literally just got out of bed, so I apologize. But the moon phase has started to take place. I can tell I'm much whiter up here than I normally am. So the good news is the pain in my left eye is almost completely gone. That's because the Solu-Medrol is definitely working to stop all the inflammation going on in my body, including that nerve behind that eye. My vision is pretty good. It's not 100%. I haven't seen any red yet this morning, and red and yellow right now are not red and yellow, so I'll have to check that out a little bit later outside. And did not sleep well. I was up until 2, and that's even with some sleeping medications. So I'm definitely having the side effect of the insomnia. I already feel really warm and flushed, and I'm about to start my final infusion, so I'm sure I'll feel great afterwards. I'm going to turn the camera around and show you how I hook up to my infusion. So here's my site. I cannot wait to take this off. The tape always bothers me. Just had it taped up overnight, so now I'm going to pull this portion down so I can hold it in my hand. I've got a little alcohol swab. My hands are clean, I just washed them. I'm going to clean my port, and then I'm going to take my flush and take off this little white cap. There is some air in there, so I'm going to go ahead and push out the air. There we go. And then I'm just going to screw this on to the blue port. They work just like a screwdriver would to a screw. And there's a little bit of backflash, a little bit of blood there in my line, so I'm going to go ahead and give it a good flush of 10 cc's to make sure my line is still good. Feels like it's still in the vein, so that's great. Just gonna go ahead and continue to flush it with this over a few seconds. This isn't a huge line. It's not like a Quinton cath or a portacath. I mean, this is just a small gauge IV line, so it takes a little bit longer to flush than some of the bigger ports. Now, if this wasn't in the vein, you'd see swelling and have pain right around the area, and that would be the time to call your home health agency and let them know that your line is no longer working. and they could send someone out to start a new line. So there you go. That's done. Now, here's my last dose. It is 1,000 milligrams, and just like a little vacuum sealed. It's cold, it's been in the fridge. You do have to refrigerate it. So I just set it in my lap, and then it's got this little port here. I'm just gonna take this off and go directly into my blue port. And once I have done that, all you have to do is make sure that you're not clamped here on this little white clamp. And the way that you do that is, it is clamped now, is you just kind of push it down and it pops out. So that makes sense. And now it is free flowing, and you don't have to elevate this above your body or anything. It is a vacuum system, and so you can just start to see it flow. You'll definitely start to feel the side effects within a few minutes, and it is a cold infusion, so I can feel it now going through. Now I just sit here. I usually set this over here to the side, put in my earbuds, and watch some YouTube. So quick little update, I'm about 50% done with my third infusion. I wanted to mention this device is called the PVAD. It's an AccuFlow device. Since this will be my last infusion, I'll probably cut it open just to see what the inside looks like. It shrinks down. I wanted to show you guys. You get a lot of space here between the shell and the internal portion that is actually vacuum sealed. It's the medication there in the center, and I feel very nauseous, definitely flushed, and my heart's racing a little bit, and it's not a great feeling, but it's an important medication, so just want to give you guys an update. So here's our empty Solumedrol. I'm going to go ahead and set that up here. As you can tell, it is finished, and I have a little bit of blood flashing back into the stream. So what I'm going to do now is I'm going to disconnect this port. To make it a little easier, I'm going to untape this one piece of tape so that I can hold it with this hand. And you just unclamp this portion, and all of that tubing and the empty Solumedrol will go in the trash. I'm going to take a little alcohol swab here, and I'm going to clean the end of the port. I have clean hands, of course. You could wear gloves, but this is my own body. And then I have an IV flush. This is just sodium chloride. Just make sure that you don't have any air at the top. And then you just go directly into the port, screws on. And then we're just going to clear the line so that that blood doesn't obstruct my IV access. Keep it nice and clear. This is, I believe, 10 mLs, yeah. You just push it through. You can feel it, it's cold. And I can tell there's no swelling at the site, so my line is still good. So there we go, we've got a clean line. And now we just unscrew. Okay, so I'm just going to show you how I anchor my hep lock. I just turn it in towards my arm. And this tape is too thick for the area that I am working with, so I just basically cut it in half. Tears very easily. And I just get it as close as I can. That looks a lot better. So now that's what it looks like. This is our clear dressing, keeping our access in place. Got one anchor here and one here that I keep on at all times, and this one is the one that I pull off when I'm going to access. You get these little cute things that stretch quite well. And I'm feeling ready for a nap, so I'm going to go ahead and wear this. So you just stretch it on your arm or over any place that you need to hold equipment close to the body so it doesn't get bumped or pulled. So I wouldn't want this hanging out if I'm turning in bed because it could easily snag and then take my line out. I'd have to have another nurse out to put another line in. Now, I only really need this portion of my arm protected, so you can always double it up. And then that way you've got a little bit heavier protection and you don't feel like you're wearing a shirt. Okay, it's time to take my line out. I wanted to show you real quick before I did that how I wrap it for showers. I use little gallon bags that are just food storage bags. And what I like to do is cut the bottom because the top is already open. And then I just put my whole arm through the bag, kind of twist it around my arm. It's kind of hard to film it and show you at the same time, but basically it ends up being like you would wrap a cast before going in the shower, and I just use some medical tape to wrap above the IV site and around my wrist so it's nice and snug, because you will be showering with your access at home. So I wanted to mention that. And so now I finished my last treatment. It's all empty. We'll dissect this so we can see what it looks like, but this is what it looks like when it's empty. It's no longer a ball, it's just kind of flat. And I just have a little alcohol swab. I have some cotton balls. They actually didn't have any gauze in my kit, and I grabbed a Band-Aid from my home. So all you're gonna wanna do is obviously wash your hands, take your tape off. It's gonna feel so good to get this tape off. Can't even tell you. And this transderm stuff really sticks to your skin. So it is also going to stick to that port. So be careful when you're loosening this, because the IV can often just fly out as you're loosening this. It's so attached to it. So all I want to do is grab my cotton balls, because this is in a vein obviously, and being a nurse, I'm going to just stick this really firmly up against here and do it one-handed. You're going to want to pull straight out and down, and then just hold some pressure here for a couple minutes. And what you want to do is just make sure that the tip of your port is still intact, obviously, that it's not stuck halfway in you and halfway out. That's what it'll look like. And then once you're sure that your bleeding has stopped, you can go ahead and clean it with an alcohol swab and put a Band-Aid on it. So I hope this has been a helpful video for you guys. It's not my normal content, but it's something I'm going through right now, and I thought if it could help anyone out there who's looking into treatment, that I would share a little bit about my experience. Thank you all so much for watching, and I'll see you back very soon.